Cassandra. We're here at Rejuvenation MD getting ready to do QWO on the lateral anterior thigh here. So QWO is a product that we use to bust the cellulite apart in thighs and buttocks. So 1, 2, 3. Are you doing okay?
Yeah.
1, 2, 3. So we do have to manipulate the needle in there quite a bit, and that's to get around those fibrous septae that hold down the skin and create the dimple. 1, 2, 3. You can see some of those fibrous septae as I pull the needle out. It does tend to bend the needle a little bit as we work around the fibrous septae and to bust them up. 1, 2, 3. So with the first treatment, there's quite a bit of bruising that happens, and the bruising hangs around for several weeks, even until your second treatment, which will be 31 days apart. With the second treatment, the bruising doesn't tend to linger quite the same way as it does with the first, and then with the third one, it's just a few days worth of bruising. But the bruising does, some people do have quite a bit of shadowing, and what that means is the bruise hangs around, even though it's not a very, noticeable bruise, you can still kind of see the outline of the bruising. This doesn't seem to be the case with this patient, but with some patients that is something that we see. And I think in general, people that have treatment, they're doing their posterior, their back of their thighs. I think that's a more tender treatment in terms of healing from, because you're sitting on your thighs, where when it's on the front of the leg, I don't think it's quite as uncomfortable. I think probably the bruising is the most underestimated part of the treatment for my patients, but most of them don't report to it being too painful, just really unsightly. So you don't want to do this right before you go on a trip or you get married, or you want to give plenty of head time before you're doing this procedure. 2, 3. Hanging there okay?
Yeah.
Last one on this side.